Student midwife Natalie was keen to try the technique after seeing the results firsthand.
Yeah, I have, and I've seen it work really, really well, which was why I was really keen to come along and do it.
And Jay, you were up for it?
Yeah, anything that makes Natalie feel better and more relaxed during labour is going to be a plus, and also with her being a student midwife I feel a bit disadvantaged in not knowing enough, so it sort of gets me a bit more involved, and yeah, it seems really good.
Can you manage to get that part of your arm sliding across? Because that then actually is quite comfortable rather than just having your hand.
Okay.
Linda's been running the programme for several years at the Horton Maternity Unit with the full support of midwifery manager Anne Haynes.
I met Linda 6 years ago when I came to the Horton as delivery suite manager, and I got involved really as a midwife and also as the manager of delivery suite. I was at the time looking at environmental conditions that women should labour in to benefit them with the physiology of childbirth, to relax, to calm, and we were looking for offering up a non-pharmacological, so a drug-free coping strategy that they could use again to enhance the normality of birth.
It's not just the expectant mother who benefits. Massage in labour can have positive effects on the birth partner too.
We found it amazing the way it reduces the anxiety in the partner, because they're often a little nervous at the beginning of labour, and once they get into the massage they relax noticeably as the mum relaxes, so it works for both of them actually, the partner doing it. And of course it doesn't have to be your husband or male partner, it can be your mum or your friend, your doula, anyone who's going to work with you through labour really. It works very well.
At the moment, we're the only ones that are teaching the programme, but we have recently started some courses for midwives and for massage therapists, for doulas, for anyone actually professional that works with pregnant women, and so they are national courses. And one of the reasons we decided to start this was that we are getting queries from couples around the country asking whether they've got anyone in their area that teaches it. And because we don't, we thought we better initiate something like courses as well to support couples around the country.
During a long or difficult labour, there may be a need for something stronger than gas and air. Midwives in the UK are licensed to administer a drug called pethidine by intramuscular injection. It certainly isn't their first choice for pain relief, but it does sometimes have its uses, as Virginia knows only too well.
I think pethidine is not a nice drug. I think that it does have lots of downsides to it. It can make women feel drunk, it has a very strong amnesiac effect, you lose perception of time, and once it's in the bloodstream you've got to wait for it to wear off, you can't take it back out again. It does cross the placenta, it can make the baby feel be very sleepy at birth and not feed very well. It can necessitate, with some babies, needed resuscitation. So all in all, it's not an ideal drug. However, I do believe that there is a place for it in some labours. I think that some women can benefit from it. I think especially women having long labours, it can give them a few hours of respite. I think it can help them relax when they're very stressed. But it should be used appropriately.
Claire has been labouring for 2 days with very little sleep, and her midwife Virginia feels that pethidine may help.
Yeah, she's going to have a shot of pethidine to help her get some sleep. It's not her first choice. She wouldn't have written it as a choice in labour, but it's always best to keep an open mind, and for some women it can help them relax for a little while and get over a sticky period and get on to the next stage. So we'll see how it goes. But she's going to try and lay down on her side, having had some pethidine, suck on the gas and air with Tony giving her a cuddle, and we'll see what happens in a few hours.